So I'm gonna come in the room. Hi, my name's Tanner. I'll be your student nurse today. Today we're gonna be doing a full head-to-toe assessment. Can I get your name and date of birth? And do you have any allergies I need to be aware of? I'm gonna sanitize my hands. I'm gonna check their wristband to make sure it matches what they just told me.
So I'm gonna
Make sure this is the right patient.
abdomen, look for any distensions, any bulges, and
I'm gonna go ahead and position my patient for
I don't see any. Then I would auscultate. So I'd start in the right lower quadrant. I would listen to, if I don't hear any sounds, I would listen to each quadrant for 5 minutes to establish new sounds. Then do hear hyperactive sounds.
So my patient's position. Right now I'm looking for their facial expressions. They seem to be happy, in a good mood, happy to be here. And I'm looking at their skin color. It's appropriate for his ethnicity. I'm also listening for their speech, if it's slurred, or they're rambling, or anything like that. It's their speech is easy to understand. They can repeat back what I'm saying to them. They're responsive to all my questions. And then I'm gonna ask my patient if they're experiencing any pain. 0 being no pain, 10 being the worst pain, and they rate it 0 or no
inspect the
pain.
leg for any breakdowns. Skin is evenly distributed.
And I'm gonna get their vitals. Their blood pressure is 120 over 80. Their pulse is 80 beats per minute.
Then I would inspect
And
the
then
tibial.
their temperature is 97.8. Their oxygen saturation is 98% on room air. This patient is 6 feet, 170 pounds.
The capillary flow is less than 3
And then
seconds.
I'm gonna go ahead and put
so now I'm
on
just gonna,
my gloves,
check the
and I'm gonna
range of
start
motion. So can you move your knee
with
towards
just an
you?
inspection of their scalp,
Okay.
to make sure there's nothing obvious, no lesions, hair loss, anything like that.
Now can you
And I'm gonna
move
go
your
ahead and palpate
ankle?
the scalp.
Checking
I'm
for
just
range
checking
of
for
motion.
any growth of any bacterial
Thank you.
growth, any hair
Okay, now I'm
loss,
gonna check the
redness.
Going
I can check
outward.
the back of the head to make sure there's no skin
Okay, any
breakdown.
discomfort? Okay, with your foot,
Everything
can you
looks
push
good.
on my foot? I mean, on my hand. Okay, perfect. Can you flex
And
it
then
towards you?
their facial expressions
Okay,
are pleasant, seem happy to be
I'm gonna move
here.
to the other side and
Um,
do the other leg.
I'm gonna go ahead and palpate their frontal sinuses right here, just seeing if there's any.
Moving to this side.
I'm checking to make sure there's no swelling, tenderness, they're not in any
So I'm
pain.
inspecting again
Also
for
palpating
any,
their maxillary sinuses, same thing, just make sure there's no tenderness or pain.
any erythema.
And then
I'm gonna
while I'm here, I'm gonna go ahead and palpate their cervical lymph nodes for tenderness, pain, swelling.
Now I'm inspecting the pulse in
Um,
the eye.
I'm gonna go ahead and test their visual fields.
Close to
So
around the ankle.
I'm gonna be doing
Between the toes.
how many
for any skin breakdown also.
fingers am I holding up over
Close
here?
any skin breakdown
3.
underneath the
And then
heel of the foot either.
come around to the side.
Check for capillary
Ask them how
flow,
many fingers I'm
capillary
holding
flow
up.
less than 3 seconds. And then now I check the range of motion. Alright, so we're gonna do the same thing that we did on the other side. Can you move
Okay.
towards
I'm
your
gonna be
body?
testing their ocular muscles. So I'm gonna have them focus on the tip of my
And
pen.
now we're gonna check for your hip, moving to the out to the side. Opening now your ankle. Can you rotate it? Okay, perfect. Can you put in,
Okay.
can you push against my hand?
I'm gonna go ahead
Okay, can you flex
and
back towards
use my
you?
light,
Okay,
shine it at the
now I'm
bridge
just
of their
gonna check
nose,
the
make
back
sure there's
side
even
of the
pupil
glove.
constriction. Same thing on both sides. Okay, everything is even, symmetrical. I'm gonna go ahead and ask them to look at the tip of my pen, focus on that as I bring it closer to make sure they are able to accommodate for depth perception. So their pupils are even, round, reactive to light and accommodations.
Are you
I'm gonna look at their external ear. I'm inspecting for any abnormalities, making sure everything is symmetrical on both sides. And then I'm gonna shine my pen light in their ear to make sure there's no excess wax buildup. Also, I will whisper on their right side as well as their left side to make sure they can hear what I'm saying and repeat back what I just said. I'm going to ask my patient to stick out their tongue.
I'm gonna lay you back down.
And I'm going to look in their mouth, make sure there's nothing abnormal.
Okay, sir.
Alright, so I'm going to move on to their neck. I'm inspecting for any lesions, abnormalities, symmetry.
We're gonna do one thing.
I'm gonna go ahead and have my patient turn their head to the left and the right, and I'm checking for jugular vein distension. I'm also gonna ask them to look down, look up to make sure their cervical range of motion is good.
Would you like the bed raised?
Yes, please.
I'm gonna go ahead and put my hands on the top of my patient's shoulders with a little bit of resistance. Ask them to shrug their shoulders to make sure they have strength. They can lift up against resistance. I'm gonna ask my patient if they've had any productive cough or they're a smoker. They say no. And I'm gonna go ahead and move down to their chest. So I'm gonna pull this down. And I'm looking for any obvious lesions. I'm checking for symmetry. Skin looks good. Skin is even toned. And then I'm going to listen for their lung sounds. I'm going to ask that they breathe in and out every time they feel me place my stethoscope on their chest.
Sounds good.
Yeah?
So I'm going to start right here.
You on it?
Have them breathe in and out.
Yeah.
I'm at the second intercostal space. I'm gonna move down, breathe in and out, move over, breathe in and out, down again,
I didn't
breathe
do
in
the
and out.
whisper test. I didn't do the cardinal.
Oh, damn.
You didn't even catch it. I have to redo it, huh? How much would it be to go?
How much is it worth in here? It's 10 points for the head, and that's probably 2 or 4.
I did parallel.
Okay, lung sounds are clear in all fields, no crackles, no wheezing. Now I'm gonna go ahead and listen for their heart sounds. So I'm
I
gonna
can't believe I forgot.
start over here
Is there
and in the aortic area. I'm gonna move over to the pulmonic area. And then down to the third intercostal space for Herb's point. And then fourth intercostal space for the tricuspid area. And then the fifth intercostal space for the, this is the mitral area. I'm also gonna do my PMI here and listen for a full minute for their apical pulse. I have clear S1 and S2 sounds, no murmurs, nothing abnormal. They have even lung expansion. There's no abnormalities in their chest wall, and their breathing is unlabored.
I don't want to redo this shit. Should I just turn it on like that?
All right, I'm gonna cover my patient up, and I'm gonna go ahead and check their upper extremities. So, with their right arm, I'm just inspecting, making sure there's no abnormalities, lesions. Everything looks good. I'm also gonna go ahead and check this arm as well. I'm just making sure everything is symmetrical. So everything's symmetrical in length and size and shape. And then I'm gonna go ahead and palpate their radial pulses on both sides. So it's a 2+ on this side. Palpate on this side, same thing, it's a 2+, so pulses, radial pulses are even bilaterally. I'm also going to be feeling their skin to make sure that it is warm on both sides. So both their upper extremities are warm to the touch. I'm also going to be looking under their arms to make sure there's no growth of any kind or moisture. I can check with their elbows to make sure there's no signs of skin breakdown. I'm going to do the same thing over here, checking under their arms, no growth, no moisture. Looking under their elbow to make sure there's no skin breakdown. And I'm going to come down to their hands, and I'm going to test their capillary refill on the right side. I'm just going to squeeze their thumb, let go. It's less than 3 seconds, it's good. I'm checking between all their fingers, make sure there's no abnormalities. And I'm going to go ahead and test their grip strength. I'm going to have them squeeze my hand. It's firm on this side, and I'll come over here. And I'm going to do the same thing. I'm going to squeeze their thumb, testing for capillary refill. It's even on both their sides. I'm going to have them squeeze my hand again and make sure it's firm. Checking between all the fingers. Everything looks good. Okay. I'm going to also test my patient's range of motion. I'm going to have them lift their arm above their head. Bring their arm down, and then have them bring their arms out and in, and also have them flex at the elbow and then extend, making sure there's no pain or tenderness when they're doing those, and they have full range of motion. I'm also going to have them, can't do it on these, but have their hand flex inwards and outwards, spread their fingers. I'm also going to pinch the back of their elbows to make sure that there is no tenting. Their skin is brisk. I'm going to do the same thing on this side. Just back of their elbows. It's brisk, no tenting. Goes right back in place. All right. And then I'm going to go ahead and expose my patient's abdomen.
I was just gonna let you guys know we've already filmed.
What was it?
I was just gonna say it's easiest to upload them as a YouTube video on the YouTube app. Make sure it's unlisted, and then copy the link, send it through a Blackboard message to her only, because otherwise it's not been working for anyone.
Bet. Appreciate it.
So now I'm on to their abdomen. I'm going to inspect, make sure everything is symmetrical. No skin abnormalities. And then I'm going to auscultate for the vowel sounds. Okay. I'm going to start in the right lower quadrant. And then the right upper quadrant. Left upper quadrant. And then the left lower quadrant. Okay. So there were active vowel sounds in all 4 quadrants. If there were no vowel sounds, I would wait 5 minutes. Okay. And then I'm going to go ahead and palpate. Okay. I'm going to go ahead and percuss the abdomen. I'm doing this to check and see if there is any signs of fluid buildup, distension, anything like that. And then I'm going to go ahead and palpate their abdomen. So I'm just going to start out with light pressure, and then I'm going to then do firm pressure a little bit deeper. Checking this time I'm checking for any lumps. So everything's good. All right, I'm going to go ahead and cover them up. Okay. to their lower extremities. I'm going to start with your right leg. So try to keep them covered. Okay, so I'm inspecting the skin, everything's symmetrical. No skin breakdown, no abnormalities here. And then I'm going to go ahead and feel their skin, make sure it's warm to the touch. I'm going to press down a little bit right here to make sure there's no signs of edema. And then I'm going to look between each of the toes to make sure there's no growth. All right. I'm going to go ahead and palpate for their popliteal pulse right here. So I'm going to squeeze in. Okay, it's 2+. And then the posterior tibial pulse right here on the back. Okay. And then as well as their pedal pulse, dorsal pedal pulse right here. Okay. I'm also going to go ahead and look at the bottom of their foot, make sure there's no skin breakdown, check the back of the ankle, make sure there's no signs of skin breakdown. And then while I'm here, I'm going to go ahead and check their range of motion. I'm going to ask that they bend at the knee, bring their leg up, and then extend outwards. And then go ahead and have them bring their leg outwards towards me, and then back inwards, making sure they have complete range of motion of their leg. And I'm gonna, yep. All right, and then I'm gonna have them press against. I'm gonna apply a little bit of pressure and have them press against my hand, and then have them do the same thing upwards. I'm gonna apply pressure and have them go this way. Okay, cover that back up. I'm going to do the same thing on the left leg. Expose this. Okay. So I'm checking again over the leg, make sure there's no sign of anything abnormal. It's symmetrical with the right leg. I'm going to feel their skin, make sure it is warm to the touch. And then I'm going to go ahead and check their range of motion. Have them go outwards, then inwards, and then bend at the knee, and then go outwards. Okay. And then I'm going to place my hand here, apply pressure, have them go upwards, apply pressure here, have them press against my hand. Okay. And then I'm going to go ahead and check in between all of the toes, make sure there's no fungus or any kind of growth. I'm going to check the bottom of the foot and the back of the ankle to make sure there's no skin breakdown or lesions. Okay, I'm also going to go ahead and feel their popliteal pulse on the back of the knee. Okay, it's 2+, same as the other side. Check their posterior tibial pulse. It's 2+, and then their dorsal pedal pulse. And then I'm going to go ahead and check their capillary refill. So squeeze their toe, let off. It's less than 3 seconds, that's good. I'm going to cover them up a little bit. And then check their capillary refill on this side. Squeeze your big toe. It's less than 3 seconds. Okay. So I'm going to raise the rail on that side. I'm going to pull my blanket down, try to keep my patient covered. Okay, I'm going to let them know I'm going to be turning them over so I can look at their back. I'm going to have them cross their left leg over. And then have them put their left arm over there. I'm going to ask them that they grab that rail over there. And I'm going to roll this up, pull them a little bit towards me. and then I'm going to flip them over. So here I'm going to be looking at the back of their head, especially back of their head, the sacral area, the back of the legs, to make sure there are no signs of skin breakdown. And then I'm also going to do their posterior lung sounds here. I'm going to be checking this area to make sure there's no signs of skin breakdown. Their skin tone is even here. There's no signs of lesions, abnormalities. That's it. And then I'm going to gently kind of flip them back over. Alright. Cover them back up. So I'm going to go ahead and lower that bed rail. Make sure my patient's comfortable. So I'm going to lower them back down. Yep, so I'm going to lower my patient back down. There we go. So I'm going to lower them to the lowest position. And then I'm going to ask that they sit on the side of the bed. And then have them stand up if they're able to and walk from one end of the room to the other, so I can assess their gait, make sure they are well balanced and walk at a good pace. And then have them lay back down on the bed, make sure my patient's comfortable, their bed's in the lowest position. And then I'm going to wash my hands, document everything, report anything I need to the healthcare provider.